Hi, it's Mark from Top Local. I'm here with Will Cito of Insync Physio in Vancouver. One of the best physiotherapy shops in Vancouver, multiple time winners of Best Physiotherapists in Vancouver, and their star, their owner, Will Cito, who's many times voted the best physio in Vancouver, as voted by his customers. And we're going to talk about a real common issue, traumatic rotator cuff injuries. Will, how are you doing?
Yeah, hi Mark. I'm doing great. Thanks for having me on today. So yeah, rotator cuff injuries. So when we talk about rotator cuff traumatic injuries, they can obviously be quite worrisome. And when you have that happen, you're kind of left wondering, like what should I really do about it?
So just for those who might not know, rotator cuff, that's a real common term. We heard about it in baseball. What is a rotator cuff?
Yeah, excellent question. So we like to refer to it as like a rotator cuff interval, but to keep it simple, like when we think of the rotator cuff, it's primarily composed of 4 muscles and tendons that attach onto like the arm or in the shoulder joint. And so, I don't want to complicate it too much, but basically the names of them, there's 4 of them. You have your supraspinatus, infraspinatus, teres minor, and subscapularis. So you have the 4 rotator cuff muscles that basically what they do is they act like a suspension bridge. So if you think of like you have those 4 muscles and they create this like ability to stabilize your shoulder because your shoulder has this 360 degrees of motion and movement, right? So that's the primary function. Then you also have your capsule and your ligaments that are intimately connected with that.
So when you injure your rotator cuff, you've hurt your shoulder doing something with your arm and shoulder, basically.
Yeah, exactly. So I see this a lot and, many different sports, but one in particular who is a gentleman that had a fall from skiing. And I mean, he's quite an athletic gentleman to begin with, and he does rock climbing, but his specific thing that he did, he actually fell down skiing, like from last year. And it really struck me because I remember like he came in and, he did have some limited range of motion. And he definitely was the kind of person that was very functional to begin with, like right after the injury. And so he really wanted to get better fast. So he was always pushing it. There are specific tests that we do to really pinpoint and really isolate, okay, what part of the rotator cuff. And so when we looked at his shoulder, definitely had all the compensation issues already right away that was going on, like just, his lats and his pecs were kicking in. And so certain muscle imbalances were already there, whether they were pre-existing, but definitely I think it was because of the injury. And ultimately, what we wanted to do is we wanted to do more of the conservative measure in terms of taking him through the physio portion of it and looking at range of motion, getting his motion back, looking at getting his strength, and really starting to hone in on activation of that rotator cuff. Talked about the rotator cuff is, if you think of the 4 of them, it's like a suspension bridge. And when one of them is injured, then now you have this imbalance. So then it pulls differently. And so we want to try and get that other one that's been injured to heal and to kind of get that working properly. And then all the other ones sort of follow suit as well and to kind of just be able to provide this, what you call dynamic stability in that whole shoulder joint. Because the shoulder, what makes it really unique is that, like I was saying, it provides you this 360 degrees of movement. If you can imagine like a baseball, sitting on a golf tee, right? And then you have all this cartilage that kind of makes it a little bit deeper, so the bowl, but then it needs to be stabilized by muscle because it's not like your elbow or your knee where you have a stop right there where you can, be able to limit your range. And that's why it's more like this 360 degrees type of motion. And then there's a lot of other factors to consider with regards to, looking at the muscle control around the whole shoulder blade. So if you have all this compensation going on when you have an injury, then you have to address that. So we want to try and normalize that. So basically the first 3 or 4 sessions, we really looked at normalizing things and then trying to get the motion back and get the activation patterns. And quite honestly, if things weren't progressing well or they're progressing quite slowly, then I would refer over to a specialist like one of our sports medicine physicians that we have in the back of our pocket, so to speak, who really likes to take on clients of ours, and we can get them in to see them pretty quickly. And so that's a really benefit to be able to do that, because then they're able to get through the process and I communicate with them. I work with the sports medicine physician to be able to expedite certain things and to look at, do we need to get scans like an MRI or something like that. So it happened to be that this person needed that. His progress was really slow. And it turned out that he had a full-on thickness tear. It was like a pretty large, like more than 3/4 of his rotator cuff was torn. And so they decided to operate because it was, definitely the weakness part of it. That's where you really find, this dysfunction. He wasn't complaining of pain very much other than the fact when it limited his motion. But the reason why he couldn't go all the way up was because when we tested him, and obviously his strength was really poor. So he ended up getting somehow fast-tracked when we got him to see the sports medicine physician. He had surgery. And so the surgery was the thing that he elected to do because he's very active and he wanted to be able to rock climb and ski and all that stuff. And that was actually a year ago. So, and I've seen him since, and he's actually back rock climbing and skiing again without any problems. But that's been a full year of rehab for his surgery. So it's been a really success story in that way.
So if you've fallen on yourself and you find that you've got a lot of pain in your shoulder, if you've injured it playing some sport or recreational activity, or it could even happen in a car accident, guys to see are Insync physios. They're experts at getting you back moving properly in your life. Reach them at their Vancouver office, 604-566-9716, or in North Burnaby, 604-298-4878. If you want to book online, you can do that at their website, insyncphysio.com. It's really simple to use, and it will get you able to pick whichever physiotherapist you want to see. Thanks a lot, Will.
Thanks, Mark.